the 1918 flu pandemic, sources of news were limited. But today, with the 24-hour news cycle and on-demand searches offering up sometimes different versions of reality, it's hard for people to know who to turn to. During this pandemic, a respected group of voices emerged. Together, they reassured people, provided trusted counsel, and advocated tirelessly for the health and well-being of all Americans. What compelled them to be our translators? Where did they find the fortitude to stay both current and confident in ever-evolving circumstances? Today, we will honor Dr. Ashish Jha, who over the course of the past 18 months has made countless appearances in his ongoing efforts to explain the evidence and bring trusted advice into the homes of many Americans night after night. First, I'd like to introduce Dr. Jha to our audience. Dr. Ashish Jha is a practicing physician recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research around Ebola and is on the front lines of the COVID-19 response, leading national and international analysis of key issues and advising state and federal policymakers. He has extensively researched how to improve the quality and reduce the cost of healthcare, focusing on the impact of public health policy nationally and around the globe. Dr. Jha was previously a faculty member at Harvard Medical School and is now Dean of the School of Public Health at Brown University. Dr. Jha, thank you so much for joining us today.
Sarah, thanks for having me here.
So I'd like to begin by asking you to describe the moment that you realized this was really going to be the worst pandemic since the 1918 flu pandemic. What was going through your mind, and what are some of your thoughts as you reflect on it now?
Yeah, there were a couple of moments. It sort of, I think, came to me, it became, obvious kind of over time. My first real concern was in late January of 2020. As we started seeing data coming out of China. I actually wrote a piece in Health Affairs where I laid out my concerns about the global situation. Though I will tell you, one of the things I got wrong was I said I was not that worried about the United States because we had so much capability, so much capacity that I really thought we were going to manage this. In late February was sort of the second realization where I was speaking to a journalist and I realized we had wasted 5 weeks doing essentially no preparation. We didn't have a testing infrastructure set up, and that community spread was probably happening in America, and yet we really just didn't know. And I remember the moment just going, oh my God, like 5 weeks is a lifetime to waste with a pandemic. And we really did. And soon thereafter, I was running the Harvard Global Health Institute at the time. I walked into the office one day, I think it was March 4th or 5th, and I called a team meeting and I said, whatever everybody else was working on yesterday, starting today, we're all working on COVID. We didn't call it COVID at the time. And at that moment, I think it was very clear that we were really in a very bad situation in our country and that the weeks, months, and really the years ahead would be highly disrupted because of this virus.
Thank you. And what an astonishing thing to realize, I'm sure. And now by the summer of 2020, you were doing, I think, 10 to 12 TV interviews a day. I think you've been cited 60,000 or more times. I mean, people were just hungry for information. So why did you personally feel compelled to serve in this way with everything else that you have been doing to combat the pandemic? And what do you think is the hardest part about being known as an expert on COVID?
Yeah, so, it started soon after that meeting I had with my team. We started putting out some analysis, started getting phone calls from journalists, and started appearing on TV as well as in print media, trying to explain the situation we were in. And my mental model was that, like my kind of engagement with the media was going to last a week or two until the CDC started doing daily briefings, and then people would want to listen to the experts from the CDC, and maybe every once in a while I might comment on something. But my mental model was that, we have a really terrific public health agency and they're going to step up and they're going to play that role, and that'll be great. And what happened was the media calls kept coming and coming at some point, probably about 150, 200 calls a day, trying to filter those. And I realized that the CDC wasn't showing up, that the White House briefings that were being done were actually not that helpful. And they often spread more misinformation than correct information. And I think several of us really found ourselves in the thick of trying to explain to the American people what was going on. And I remember around the end of April, just feeling a bit exhausted by all of this and asking, why am I doing this? And does this make any sense? And actually saying to my team, I think it's probably time for me to stop. But as I started talking to family and friends, I realized that there's this hunger for information, that in a public health crisis, the public needs to understand what is happening, what the prognosis is, what they can do to keep themselves safe. And unfortunately, there wasn't that kind of information widely available, and that it is the job of public health leaders to engage with the public at those moments. And so this wasn't a side thing that I was doing. I realized it was actually part of my job as a public health person. So trying to find that balance has always been tricky, but part of the reason I've continued to engage in it is because the feedback I got was it was actually useful for people at a moment when they needed that information.
Thank you. And you know, you really pointed to trends, of course, the misinformation and unfortunately the divisions that still consume us. And then kind of the changing nature of the information. It was evolving, right? I mean, what does that tell you about how we need to handle future pandemics? I mean, people would get frustrated because the evidence changed, and then it was hard to distinguish that from the, you know, sometimes misinformation or disinformation, right?
Yeah, absolutely. And I think one of the things I've learned, and there are many lessons I've learned in this pandemic, certainly around communication, but one of them is that you've got to talk to people about process. Now, nobody wants to talk about process. People just want to hear, well, what's the right answer? And often it's important to explain to people that there is a scientific process that we use, and that means this is the best answer today. But that in 6 months, it might be a different answer, and that's okay. In fact, that's how I practice clinical medicine. The things I do in the hospital today are different than what I did 15 years ago. It wasn't that I was wrong then. It was just that was the latest evidence, and as evidence changes, practice changes. Trying to help people understand that, I think, is a really important part of that communication. When we don't do that in public health, and when we act with more certainty than we have, then we actually set ourselves up for a loss of credibility when that information and knowledge changes. So I think that's a really important part of the communication that we haven't, as a community, always gotten right. I myself, I haven't always gotten that right. All of us have struggled with that, but I think it's a really important part of how we do this well.
Thank you. It's such an important caution, because everything is in memes these days. I think I saw a meme that said science is the search for the truth. Science is not, it's the process of searching for the truth.
Exactly.
Yeah. And so, okay, one last question. So back in the spring of 2020, I believe you said that, we're in the third inning of a 9-inning baseball game. What inning are we in now? And what do you think America needs to do to prevent, another pandemic or God forbid, a doubleheader, if you will, of this kind of crisis from happening again?
Yeah, I did say that in the spring, and I meant it. And I, in my mental model, the pandemic, the acute phase of the pandemic, was going to be over hopefully by this summer. And so I guess we're in extra innings. And I think we're in extra innings because of two things. One is back then, I could not imagine that 20, 30% of adults would not want to take the vaccine if the vaccine ended up being really safe and effective, which they have been. So I think part of it was my mental model assumed that we'd get to 90, 95% vaccination very quickly and that things would be much better. Second is I think Delta variant is way worse than what any of us were expecting. And both of those have put us into extra innings. This is a long time. We're now kind of month 20 of the acute phase of this pandemic. That's a long time to be in the acute phase. It's going a little longer than I think many of us had hoped. I do think we are going to transition out of that period. We are now slowly beginning to enter what is the more kind of endemic period of this pandemic, or this virus, which we're going to have to deal with for years. But it won't have that same sort of, crushing, dominating all parts of our lives that the virus has done over the last 18 months. It is a reminder, though, that there is no question in my mind that we are going to see more pandemics. All of the things that worried us about why we were at risk for pandemics still exist. So what do we need to do? I mean, first and foremost, obviously, we need to build up our better public health system. Our public health system, again, terrific people, did not function the way it needed to. Second is we really need to make more investments in science. It's been science that has bailed us out. Here we are, multiple effective vaccines, several effective therapies, great diagnostics. We got lucky on some of those things, and we can't assume that we're going to be able to do that every time. And we've actually got to invest a lot more in scientific platforms to be able to do that. And the last, but certainly not least, is we need a better job. We need to do a better job really communicating and training public health leaders to be better communicators. I think one of the ways we have fallen short on this is the misinformation has really hurt us as a country. And we've got to do a better job both understanding where it comes from, but then training a generation of clinical, public health, other leaders to speak up against that misinformation and really provide good information to people.
Well, Dr. Ashish Jha, thank you for everything you have done and are doing to help us continue to sift through the evidence and communicate it. We wish you all the best of luck, and we know we'll see you again. Thank you so much, and thanks to our audience for joining us today on Voices from the Frontlines.